Now, still on health in Gauteng, in preparation for the rollout of the National Health Insurance, the Gauteng Department of Health is actively preparing its healthcare facilities to meet the required standards. The department has briefed the media on its infrastructure projects and information communication technology. Joining us to discuss the department's infrastructure program further is Xolisani Galada. He's DDG for Infrastructure Unit at the Gauteng Health Department. Good evening, Mr. Galada. Thank you very much for joining us on the program. So you're looking to expedite your program of bringing the public health infrastructure to a level that meets the standards envisioned in the NHI. Just talk to us about this program.
No, thank you very much, and good evening, Mfundo, to yourself and to the viewers. Indeed, as we have indicated in the press statement that we have released, some of our facilities have been examined by the independent body, which confirms some of them have been compliant and some of them are not. Those that are not, who are in the process of putting together a plan, a maintenance plan for all of them to make sure that we bring them to the level of compliance that is required. So that's what we're doing.
Can you take us through the data then, the number that are compliant and the number that are not at this point?
Yes, in terms of, because we divide them in terms of the clinics, the hospitals and so forth. We've got 37 hospitals in the Gauteng province and 14 of them are compliant. And those that are not compliant is the ones that I'm saying we're engaging with the leadership of those facilities together with our infrastructure teams to make sure that those areas that they've been flagged by the independent body that they would have conducted those assessments, we address those issues and attend. And most importantly, Mfundo, is to make sure that the required budgets are availed. And yesterday we had a meeting, a senior management meeting within the department, including the MEC. And what we have agreed in that meeting is that we are going to reprioritize resources within the department, taking from areas that really are not a high pressure point, moving funds into this particular program to make sure that all our facilities are compliant. We will understand the
Mr.
amount.
Galada, pardon me for interjecting there. I just wanted us to be a bit more granular. When we talk about these 23 that are not compliant, what exactly are we talking about? Is it infrastructure issues? Is it staffing issues? What exactly are the issues here that have led to it being deemed non-compliant?
In the main, what is looked at is the issues around infrastructure. For an example, the issues around OHS, whether in the facility you will have your fire hydrants in place, whether there are smoke detectors, whether you have a signage that are there, whether there aren't entrances that and any other objects that are obstructive and so forth. And also just the upkeeping of the cleanliness of the facility itself. So that it can be compliant. Those are some of the issues. Those are not major issues, but they are quite important because in an event of a fire, you would want the staff and the patients to be easily evacuated.
So a smoke detector then is a major issue because like you say.
Yes, it is a major issue, and hence we are reprioritizing resources towards that to make sure that none of our facilities are left behind in terms of the safety of our patients and that of our staff. So hence we have taken this decision to redirect the funding that is required to this particular area to ensure that we are compliant. Fortunately for us, we have teams that are ready to undertake that particular work. We know what has been raised in terms of those reports, and we are attending to that.
Now, you are forward-looking. Many would say it's commendable. You're looking now to get the infrastructure to the level that is envisaged in the NHI. But some are saying just last week, Tom London, a patient, was decrying the state of the Helen Joseph Hospital. And of course, in as much as many would commend you, as I say, for just being forward-looking, some are of the view that if the basics cannot be something that you get right at this point, perhaps it would be better that you focus on the bare minimum that is required at a public hospital, not necessarily looking now to elevate the standard to that of a private facility.
No, we are in agreement with you there, Mfundo. Maybe for the benefit of yourself and the viewers, the function of maintaining these facilities and was residing with our sister department before. The MEC then, when she came, since she then decided to beef up the infrastructure unit within health. And as we speak, these are some of the things that will not be outsourcing to any other department, but will be doing that ourselves to address exactly the point that we've raised, to say, why didn't this happen in the past? This would have been a responsibility given to a certain department that would have done it, but in certain areas there would have been challenges. Upon us picking up that we needed to intervene in terms of the capacity internally, we therefore put that capacity in place, recruited the required skills, and put it in place in order for us to be ready to undertake this particular responsibility. We understand that we've got infrastructure challenges in some of the facilities, but in terms of maintenance, as I've indicated, we've got a maintenance plan for each and every facility across the province of Gauteng. The only issue that one maybe can highlight is that maybe at a particular point you do not have sufficient budget to undertake all that particular work. What you then do in that instance is that you do the issues of reprioritization. But as I'm saying to you, we are putting more effort and more direct focus on this, not because of what Mr. London would have said, but because it is the right thing to do. We need to put our facilities in a state that is required. And I'm sure some of them, in terms of OHS, for an example, out of the 37 hospitals, there's no hospital that in terms of, that is less than 70% in terms of OHS compliance, which I think you can attribute it to the hard work that we're putting in place to make sure that we are ready for NHIs and all of our facilities are compliant.
All right, Mr. Galada, thank you very much for your time this evening. That's Xolisani Galada. He's DDG for Infrastructure Unit at the Gauteng Health Department.